Hello and welcome to COVID-19 Now What, a weekly video series from the Easthampton Health Department. I'm Amy Hart, public health nurse for the city, and today is Friday, March 26th, 2021. So today I'm outside, and the reason why is that's part of my theme today is for us all to get outside whenever we can now that the weather is warming up, especially if we are going to get together with people outside our households. Barbecues, bonfires, I don't know, croquet, whatever you can do outside with people is recommended right now as we all continue to work to fight the spread of COVID. So before I go any further, I'm going to go ahead and share the dashboard with you. So give me just a sec to pull that up. Let's see here. Okay, more recent one. All right, so here is the dashboard. So we'll start by, again, looking at the top row as we usually do. We have a sea of yellow still, indicating that both Easthampton and Hampshire County remain in the yellow risk zone for the period from March 7th through March 20th. The up arrows in each box show that both cases and positivity rates, test positivity rates, have risen for Easthampton over this period. However, this is not the case for the county over the past 2 weeks and the most recent week. The recent rise in cases seems to be an Easthampton phenomenon for now. On recent contact tracing calls, I do continue to hear about very effective transmission within households where nearly everyone who lives in a home is getting sick. And I also hear about a lot of spread between households, maybe because people are experiencing pandemic fatigue and starting to socialize again, maybe without distancing or masks. So as we keep looking at the dashboard, an important area I want you to look at is the purple box on the left. This is the past week case trend. As you can see, the dates for this are a little different. It's for a 7-day period ending March 23rd. Now, the state reporting period we follow for the yellow boxes up above actually ends a few days earlier on the 20th, as I said. So this box is the most up-to-date information we have about what is going on in Easthampton currently. Now, on previous dashboards, I was reporting this box as a raw number of new cases, and it had been fairly stable over the past month. For last week, for example, I reported 13 cases in this box. This week, it was going to be 29. And when I put that down, I thought, you know, it would be better to report it as a percentage. So what we're actually looking at is an increase in local cases of 123% over for this past week from the previous week. And going forward, I think I'll continue reporting this field as a percentage of recent change instead of a raw number so we can better see the trend that has been happening most recently. Now, to give you some context for this recent increase, I looked back at data trends over the previous year, and the last time I could see a jump like this was actually in early December as the winter surge in cases was just getting going. And then that number, of course, continued to grow until we reached our local peak with 95 cases 1 week in early January. Now, I'm really hoping that we'll see a different scenario play out this time, given that we have the benefits of warmer weather. A number of local residents who were infected over the winter surge still have their natural immunity, which holds for about 90 days. And now, of course, we have the vaccine, which has reached nearly a third of local residents with either full or partial coverage, as you can see in the blue box on the right side. If you add up almost 19% fully vaccinated, almost 14% partially vaccinated, we're looking at about a third of residents in our zip code. So in the center is a graph that we're focusing on today. This one talks about racial and ethnic distribution of COVID cases and vaccination rates within those groups. Now, I've included their proportion of the overall Easthampton population as a reference. Those are the gray columns on the right. The case data goes back to the beginning of the pandemic, and the vaccination rates are from data collected since distribution began a few months ago. I have not included a column for data with unknown values just to simplify the graph. Let's look at the blue columns, which provide information about where the burden of COVID disease has fallen across different groups. And we can see this varies. For example, for Black and Asian identified groups, the proportion of COVID cases basically matches their proportion of the town's population, around 1% to 2%. We see something different with the Hispanic identified group, which comprises 5% of the local population, but has borne 10% of the COVID disease so far in Easthampton. We also see for the white identified group, which represents 90% of the population, but has experienced about 60% of COVID cases. Now, these differences feel important, and I think they're worth continued conversations about how our various roles in the workforce, our living situations, our economic realities, and even our access to information can all impact our risk of disease during the pandemic. Let's finish by looking at the orange columns, where we do see a similar dynamic playing out across vaccine distribution, where nearly all the races and ethnicities represented here, 20 to 30% of members of those groups have gotten at least one shot so far. And this roughly mirrors the overall 33% of the total population in our zip code who have been fully or partially vaxxed. However, we see that within the Hispanic group, just 12% have gotten a shot to date. I know that's a little hard to see. The graph kind of forced the numbers closer together than I would have liked. So 12% have gotten a shot to date, which is, quite a bit less than the 20 to 30% of members of other groups. So we can think about issues around access, perhaps, which may be impacted by transportation, having the free time to make an appointment and keep it. And again, access to accurate information about who can get vaccinated and even where to do that. And just so everyone understands, vaccine eligibility is based on either living or working in Massachusetts, not about whether someone has legal status to be in this country. And furthermore, vaccine sites are designed to be a safe space for everyone. Currently, the phased rollout is still underway, but starting April 19th, it will include all state residents or workers 16 years or older. So that is it for this week's dashboard. I'm going to take that down, and we'll continue with a brief discussion of variants of concern. Oops, I missed that. Variants of concern. What are they? Why do they matter? And as individuals, what can we do to stop them? So just a little refresher, variants of concerns are mutations of the original SARS-CoV-2 virus. And that's the virus that causes COVID-19 illness. Virus mutations are a normal occurrence. All living organisms undergo changes over time that help make them survive better in their unique environment. So since viruses live in animals and people, they have the potential to change or mutate within our bodies. If the mutation is a good one, in terms of the virus's perspective, it will spread to other individuals and it'll continue to live on as it spreads further to other individuals. And when we call or label a virus mutation a variant of concern, it's because we've identified particular characteristics about a variant that, for example, may help it to spread more easily between people, or it may cause more severe disease outcomes. Those are things that we'd be concerned about. And then there also are some variants that we're already seeing have developed a resistance to either the natural antibodies that we create as we fight off the virus after being infected, or the antibodies that are given to people in the hospital when they have severe disease, or the antibodies that are developed through vaccination. So that is obviously a concern as we try to end this pandemic. Now, as of today, we have identified over 400 cases of the B117 variant. That's the one that originated in the United Kingdom. And it is a concern because it is much more transmissible than the original version of SARS-CoV-2. And also, we've found that it can increase severity of the disease. And so that's one reason in Europe, we're seeing in Western Europe, a recent increase in not only cases, but also hospitalizations. And we're seeing this in a few areas in the United States as well, even regionally here in the Northeast. So this is something to pay attention to and think about as we think about why does the pandemic really matter? You know, maybe I'm a low risk person, et cetera. Things are starting to change. Two other variants I wanted to note here. One is the B1351 variant. That one comes from originally South Africa. And then the P1 variant, that one's from the Brazil area originally. We have far fewer reports of those, just 9 of the B1351 and just 4 cases so far of the P1. But they share the mutation I described earlier where they are resistant to antibodies. And so, you know, as we look at, well, why are we producing a vaccine? It's so that people can develop antibodies. But one reason is so people can develop antibodies to fight the virus. There is another way that it helps our bodies get ready in other parts of our immune system, but we won't really talk about that right now. It's a little complicated. And I also just want to bring up that there are other variants of interest. We call them variants of interest. They're not yet classified as variants of concern, but we are keeping an eye on them. And there are dozens of those, and they're all across the US. So at any point, they could move into the other category. Now, at this stage in the pandemic, if you aren't already, you're going to be hearing more about variants of concern, talked about as a real challenge to our goal of normalizing our old ways of interacting with each other again. And basically, there's this competition between the virus and the vaccine. And we humans are just caught in the middle. So it is up to all of us, especially those of us who are low risk and maybe more likely to be working outside the home or socializing with others outside our household. You know, there are things we can do to help give the vaccine the leg up that it needs to help end the pandemic. Now, as individuals, our best approach is to try to prevent the spread of COVID. Now, we know what our tools are. They're masking, social distancing, hand hygiene, and now the vaccine. Everyone needs to wear a mask that fits them very well and filters effectively whenever they're indoors with people outside their household. A double mask is even ideal. You've probably heard of this already. You're wearing a disposable surgical mask underneath and then a cloth mask on top. And what that does is it creates a better seal around the edge of the mask. You've got the double layer, so you're filtering large and tiny particles, and less air is coming out. If you're wearing a mask and there's air coming out when you're talking or breathing or laughing or sneezing, then that means air is also coming in. So you're exposed or you're exposing others or both. Now, the other thing is, as I said before, outside. Socialize outside whenever you can. It's preferable for sure right now. But if you do socialize indoors, if that's needed for some reason, you're going to think about ventilation, opening windows so you have the cross breeze going through the room. And then you also would continue to mask and social distance, wear that double mask. That'd be a good time for that. And if you're in a front-facing, like a public position, an essential worker or something, and you don't wear the medical grade PPE, then again, it's a good time to wear your double mask if you're in that role. Now, just as a final plug for the vaccine, when it's your time to be vaccinated, and soon it'll be everybody's turn after April 19th, it'll just be a matter of getting in line, basically. Please do that. It's for everybody. It's not just for you. And if you have questions about it, I really encourage you to talk to your healthcare provider about it, as opposed to relying on, stories or anecdotes you might hear, kind of outrageous things on Facebook or other social media sites, Instagram. Whoever is sharing those, they're not thinking about your best interest or the community's best interest in particular. They have a reason to share stories like that, but they're usually not a medical professional, or if they are, there's someone, again, has a different motivation. We can't know what that is, but talking to your own medical provider is what's recommended if you have concerns about getting vaccinated. So, and by the way, you can pre-register if you go onto mass.gov and just type in vaccine pre-registration. You can basically get in line, and as soon as your turn comes up and appointments are available, you'll get an email offering you days and times. So that's all I have for now. Thanks for joining me outside with the birds and the breeze, and stay well, and we're all in this together. So I'll see you next time. Thank you.